Hi, my name is Hewa Khan. I am the kidney nutrition specialist working in Boston area. And it's my pleasure to provide the lecture on nutrition and polycystic kidney disease. So we are going to talk about basics of kidney, nutrition overview, nutrition and chronic kidney disease, polycystic kidney disease, various diet, also samples of healthy meal plan today, and summarize. So we have two kidneys, most people, and they are located the lower back, and two of them are together connected with the body organs. And kidney has very important functions. One of them is maintain homeostatic balance in the body, and those are mainly fluid and electrolyte balance. And we will talk a little bit more in the future, but the fluid is very important. So if someone is very close to dialysis, they usually have more swellings and some fluid. So that's one of the things that kidney is controlling. The kidney also produce hormones, and one of them is renin. Renin is important for blood pressure control. Erythropoietin is for maintaining body to making red blood cells for our body. Vitamin D, we get the vitamin D from sunlight, but it's actually activated in the kidney and work as the active hormone. So and the last function is excretion of metabolic waste through the urine. So all this metabolic waste will be excreted through the urine. That's what kidney does. So how do we measure kidney function? It is called glomerular filtration rate. It's a GFR. It's a measurement of how well your kidneys filter blood. However, we cannot measure this GFR directly in most cases, except a very important research study. So these are estimated by calculation. So that's why we call eGFR, which is the estimated glomerular filtration rate. So there are 5 different stages of the kidney disease, and it's a stage 1 through 5. And this is the area that you are seeing about the normal function of the kidney. And then stages 3 through 5, those are the kidney disease. And if it's a further down decrease of the eGFR, it is called the kidney failure. So stage 1, it still has normal GFR, but slightly damaged. Stage 2, it's also mild decrease of the GFR, but still have very good kidney function with the filtration rate. And most of the PKD patients in early stages, they have this stage 1 or stage 2 of the CKD. The stage 3 is GFR between 30 to 59, but these are a little large range. So they divided by stage 3A and stage 3B. So these are all moderate decrease of the kidney damage. And when patient gets to stage 3B, we usually spend more time for education and try to keep their kidney function stable as possible. Stage 4 is a GFR between 15 and 29. And this is a severe decrease of the GFR with the kidney damage. So when patient has less than 20 of the GFR, usually they are preparing for a further kidney failure. The treatment called renal replacement therapy usually include dialysis, both the hemodialysis or peritoneal dialysis, and also transplant. So patient who has GFR less than 20, they are listed as a transplant recipient. If someone's GFR is less than 15, we call it kidney failure. However, many people do not start dialysis because many of them do not have the kidney failure symptoms. So many of our patients start dialysis even though they have lower than 15 GFR, but they have symptoms like such as short of breath, lot of swelling, and a very bad anemia, and accumulation of a lot of waste product in the blood. And these patients have GFR less than 10 quite often to start dialysis. Let's talk about different causes of kidney problem. Number one cause of the kidney problem is diabetes, followed by hypertension, cardiovascular disease, polycystic kidney disease, which is hereditary. So this is from 2018 by the Center for Disease Control. So the diabetes were definitely number one cause, followed by the high blood pressure. And third cause is usually for nephritis. Those are inflammation of the kidney. And polycystic kidney disease fit into other causes. And then there are more than 5% of the patients have unknown cause of the kidney disease. So this 15% also have a patient who takes over-the-counter non-steroidal anti-inflammatory drugs. I think all of you probably are very familiar with ibuprofen and the painkillers. Usually, they actually decrease the kidney function, or sometimes the patient take over-the-counter over supplement. Those are going to be also causing kidney failure. So you have to be very careful when you take any medicine or any supplement from the over-the-counter. You have to talk to your nephrologist. So this is the picture of the polycystic kidney disease. I'm going to say PKD from now on. It's the inherited problem. It's the cluster of the cysts that developed primarily within a kidney. And it will just increase the size of the kidney. And these cysts are not cancerous, and it contains fluid. The cyst varies in size, and it grows larger and larger. So when you are young and patient is young, it's a very normal size of kidney, and then it will increase with the time. Once the kidney became really large, we can also see the decrease of the kidney function. So usually later of the life have a really fast progression of the kidney disease with the decrease of the eGFR. So that's a very brief message about the kidney function and causes of kidney. Now we are talking about nutrition, which is our main topic of the day. So I know most of you already know that there are different nutrients. So we actually looking at the nutrient, macronutrient, and also micronutrient. So macronutrients are essential nutrients the body needs in large quantities to remain healthy. So this will produce energy. So these are protein, fat, and carbohydrate. So you can see these are protein sources, carbohydrate sources, and different fat sources. The micronutrients, they are also essential for body function, and these are not produced in the body. So these are they require very small quantity, and these are vitamins and minerals. So these nutrients are in all type of food, animal protein, animal sources, and plant sources, and everything that we are eating, and also different supplemental forms. So what are macronutrients? Carbohydrate is the main source of the energy. 1 gram of carbohydrate produces 4 calories, and these include sugar, like glucose, fructose, galactose, and a combination of these. So glucose is simply sugar, which is the main source of the energy in the body. The fructose is sugar from the fruit. So and then galactose is the sugar from the milk, especially dairy product. So galactose and the glucose combination is called lactose. And many people have lactose intolerance because of once they are growing up, usually have decreased enzyme. So so mostly the glucose and fructose are more for the carbohydrate sources. And these are also coming from the starch. So it's the bread, rice, and starch vegetables. There are various type of bread and rice, and also the pasta. And the starchy vegetables include the potatoes, corn, pumpkin, butternut squash, and any type of potato. And we also hear a lot about the complex carbohydrate. Complex carbohydrate is a whole wheat or anything with a lot of fiber. So this will lower something called glycemic index, so it's healthier. So all of these carbohydrates, they are not absorbed as fast as white bread or white rice because of the fiber in the ingredient of this food. So other macronutrient, protein. The protein also produce energy, but it's not efficient. It's about 4 calories per gram of protein. But it's very, very important for body function, especially growth, build muscles, repair tissues. So those are the main function of the protein. And these sources include animal and plant-based. So animal sources are fish, type of fish, shellfish, any dairy product, red meat, poultry, and plant-based sources are beans, rice, some tofu, and also some non-dairy sources of the milk. And there are 2 different types we usually call high biological value and the low biological value protein. So high biological value protein include the protein contain all essential amino acids. So essential amino acids are not synthesized in the body, but the non-essential amino acids are synthesized in the body with the different sources. So animal protein on the top, they are all high biological value protein. The beans, rice, tofu, any of those, they are not high biological value protein. However, because they are missing 1 or 2 essential amino acids in the protein. So if you eat rice and beans, one of them has one of the methionine is missing, the other one is another amino acid missing. But if they eat together, it will make a complementary protein, make a completely good high biological value type of protein. So that's what we call complementary protein. So combination of different low biological value protein, it will make a full complete protein. So the last macronutrient is a fat. It produces 9 calories per gram. So it produces a lot of calories compared to protein and carbohydrate. And it's also very important for body function. It produces hormones, especially steroid hormones, and also protect the vital organs in the body. And it's also important for body membranes. So fats are very, very important. There are several different types of fat. Depending on their structure, we call saturated fat, unsaturated fat, trans fat, and also cholesterol. The cholesterol do not produce any calories. So this diagram shows different type of fat. So you see a saturated fat, and those are coming from animal fat like poultry, but it's also from the skin. If fatty meat, there are marbled, the white ones, those are fatty, butter, and lard, full dairy, like dairy creamers, those all produce saturated fat. And also vegetable fat, for an example, coconut oil or palm oil, they also produce the saturated fat. The trans fat is actually unsaturated fat, but they in the process, they add hydrogen in the molecule and look like saturated fat. That's why this trans fat and saturated fat, they are very similar and they are not very good. However, body needs some of them for the body function as well. Unsaturated fat coming from mostly just plant-based like nuts, so olive oil, canola oil, peanut oil, avocado, those are all monounsaturated fat. Polyunsaturated fat include corn oil, soybean, sunflower, and also from the cold water fish like salmon or swordfish, and those the fish provide omega-3 fatty acid. They are very important for body function as well. So what are micronutrients? So micronutrient, I mentioned about the vitamins and minerals. The vitamins, there are two types of vitamins. One is fat-soluble vitamins. These fat-soluble vitamins are stored in the body. The water-soluble vitamins are excreted if you consume too much. So fat-soluble vitamins include vitamin A, vitamin D, vitamin E, and vitamin K. So vitamin A is important for eye. Vitamin D is important for bones, calcium absorption, immune function. Vitamin E is the immune system. And vitamin K for blood clotting and bone health. Those are the functions of ADEK. And the water-soluble vitamins are there are several different kinds, complex of B vitamins, B1, B2, B6, B12, and also biotin, folic acid, and vitamin C. All of them are from all different food sources. And if you consume extra vitamin B complex, when you go to bathroom, usually your urine to be very yellow color. That's because of excess vitamin B2. So as I told you, the excess amount of water-soluble vitamin, body is not going to store any of these vitamins and they will be all excreted. That's why it's not, the B vitamin do not have any toxic effect. However, fat-soluble vitamins can have toxic effect if a patient eats too much. The other micronutrient called minerals. So minerals include the sodium, potassium, chloride, calcium, phosphorus, sulfur, magnesium, and also iron, selenium, zinc, and other trace elements. So all of these are all we need in the body, because often patients just think that the following low sodium diet, so not eating sodium at all in the diet, is not going to be good because the body needs a certain amount of sodium for normal function. So all of these are also coming variety of different food sources and also from pure forms. So for an example, calcium, iron, some zinc, magnesium, any of these, if you are low in these minerals, we usually recommend the supplement. Now, electrolyte. Electrolyte is very important for a fluid balance in the body and also acid-base balance. So the sodium and potassium, these are extremely important for body function, and the kidney is controlling this balance. So that's why we always talk about sodium and potassium in a kidney problem. The other thing the kidney does, it just control acid and base balance, and bicarbonate in the blood. That is the indicator of the acid-base balance in our body and how this kidney control. So this balance is very important for patient, especially with chronic kidney disease patient. That's why we talk about it, and we always mention about the electrolyte with anyone who has kidney condition. Now, nutrition in chronic kidney disease and polycystic kidney disease, why these are important, and what we are going to talk about this nutrition in the chronic kidney disease. Polycystic kidney disease, PKD, is one of the causes of CKD. That's why I just will talk a little bit more specific later for the PKD, but in general, I just always put them together as a part of the CKD with the nutrition. The appropriate diet can slow progression of the chronic kidney disease. So these nutrients include protein, sodium, potassium, and phosphorus. These are most common, and we always watch these nutrients if someone has polycystic kidney disease, also chronic kidney disease. And the most important fact is diet should be individualized. There is no one diet fit for all kidney problem patients. So before I go into specific nutrients, I'm going to show you how to read the nutrition label. So these are the current nutrition label, and all information is based on one serving size. So on the label, on the A, you can see serving size is a 2/3 of cup, and also there is the number of servings per container. And this portion size on A and B, you could see on the B, serving size is 1 cup, the container have 2 servings. So on the A, the calories, you are checking calorie. Most people check calories and also check sodium. So you are going to check the sodium, and low sodium definition is sodium level less than 140 milligram per serving. But often I recommend the patient to get about 200, because there is a reason that depending on patient's medical condition. So 140 is definition, but any sodium less than 200 per serving is usually safe to consume. You can also check this added salt in the information. And then also one important information nowadays, those are the potassium. So when patient has high potassium level in the blood, I usually also check it with 200. That's why sodium and potassium, if you check it, if you have issues with potassium, about 200 is your cut point to find. The B label, it gives exactly same as the A on the second column, but the third one is about the 1 cup is the portion, and it has 2 servings per container. If a patient or anyone eats a whole container, it will just double the amount of all this information. So the one you have to pay attention is the sodium. Also, you look at the potassium. This one is very high potassium food. So it has 470 milligram per portion. But if somebody eats a whole container, it's going to be 940 milligram. So protein. Why protein is so important with chronic kidney disease? Body uses protein and then produce waste product called urea, which is removed by kidney. In CKD, this urea can be accumulated in the body as toxin. That's why when someone is very close to dialysis, usually doesn't have much of appetite, and sometimes it smells like a fish kind of smell from mouth, and that's because of urea accumulation in the blood. The protein should not be used as energy source, because the protein is not like a carbohydrate or a fat. Protein is metabolized in the kidney, and it produces energy. So kidney has to work hard to produce energy for the body, and that affects the progression of the kidney disease. So you already have like decreased kidney function, but have too much protein, and kidney has to work harder to produce energy that will decrease your kidney function even further. The amount of protein recommendation is based on the body weight. It's not like if someone is 100 pounds and someone is 200 pounds, the protein recommendation of each person is very different. So total amount of protein is the most important, not type of the protein. That means that people can have animal protein and also vegetable or plant-based protein, but plant-based protein is not better than the animal protein. There are some exceptions, but I'm not going into in detail. So in general, the type of protein is not important. Total amount of protein is important. So recommendation from most recent kidney foundation is called KETO, and also called international recommendation. It's called KDIGO. They recommend 0.6 gram to 0.8 gram per kilogram body weight. So 1 kilogram is 2.2 pounds. So if someone weighs 110 pounds, which is 50 kilograms, so this patient can have between 30 grams to 40 grams of protein per day. So 0.8 gram is definitely for someone who has diabetes. So we give a little more protein for patients with diabetes because they need a little less carbohydrate in the diet. Also, 1 ounce of protein of the food, either poultry, fish, red meat, pork, cheese, and eggs, all of these, 1 ounce provides 7 grams of protein. Also, patients need adequate amount of calories to maintain body weight or to lose weight if necessary. So high protein, low carb diet for weight management should be avoided for patients with CKD or PKD, because this high protein will promote the progression of the kidney disease. Now, some people have a lot of protein in the urine. So you need to know whether you spill protein in the urine. Protein should not be in the urine. So high protein consumption will aggravate spilling protein in the urine. So some people think that you lose protein in the urine, so you eat more. It doesn't work that way. So more protein you are consumed, it doesn't replete, it damages more. So that's why moderate amount of protein is necessary. So amount of protein is different and calculated based on the weight. Meat, fish, poultry must be measured after cooking without bone, skin, or fat. So sometimes I get questions a lot from our patient that what is the proper way of measuring? So it's always cooked protein. This is one example of low protein diet. So this one is I created as my plate. So unfortunately, this is very low protein. You see 45 grams total protein a day. And this is a person with about 130 pound weight. And you can see 3 lean protein once a day. That's the amount of protein that we talk about. And we also mention high biological protein, about 21 grams, which is the 3 ounces of meat. And also these vegetables and also starch, they also provide some amount of protein. That's why when you have low protein, you just see how much. And it's a healthy fat. So meals are based on each patient's protein calorie need. And also if someone needs a high calorie, give you a little bit more fruit and the fat. And some fruit and vegetables are not allowed if someone has high potassium in the blood. So this is again to be individualized. What other things are very important in a kidney disease? Sodium. what does the sodium do in the body? So sodium, you have a nice dinner at the restaurant and you come home and you feel very thirsty. So what you do, you drink water. So this is like a high sodium food as an example, and you drink a lot of water. What it does, you get the blood pressure. So thirst, drink water, fluid gain, and increase body, the blood pressure. So this is the consequence of the high sodium. And that's why we try to make everybody to follow a certain amount of sodium consumption per day. How much sodium do you need a day? 1 tablespoon, 1 teaspoon of salt, 1,500 milligrams of sodium. Okay. I would also ask, what is the best salt to use in cooking? This is one of the questions I get all the time. So these are different types of salt, like kosher salt, sea salt, Himalayan salt, light or salt substitute, and also people ask about Mrs. Dash. So 1 teaspoon of salt, that will provide you 2,300 milligrams of sodium. Then people ask, well, what about 1,500 milligrams of sodium? Is that okay? Yes, that's fine. If you can maintain the 1,500 milligrams of sodium, those are going to be fine. So now, kosher salt, sea salt, Himalayan salt, all of those have same amount of sodium. So in terms of sodium, it's the same. But in terms of taste, you can choose anything if you can have very little amount. Now, light salt or salt substitute, I usually do not recommend it. The reason is these are low sodium, but they are very high potassium. So if you don't have any potassium problem, if you have a low potassium, you can use some of these, but these are, you have to understand that and read the nutrition label, how much potassium these salt substitute have, because 1/3 of the salt have about sodium, 2/3 are going to be potassium. Mrs. Dash is usually fine for most of our patients. We also have patients who have low blood sodium. And the question is, should I consume more sodium in the diet if I have low sodium in the blood? The amount of fluid and type of fluid intake is very important for blood sodium. It has nothing to do with the dietary sodium. So if a patient have low blood sodium, do not consume more sodium, because if you have more sodium in the diet, drink more water, it's not going to help, it will aggravate. Why do I need to follow low sodium diet with the CKD? Because I don't have high blood pressure. So that is another question for someone who doesn't have high blood pressure. We do have many patients have high blood pressure, but sodium can also cause increased protein in the urine, because protein should not be in the urine. And if you consume high salt food, also it will increase the protein in the urine. With the CKD, you may have high blood pressure with the progression of kidney disease. So that is the reason that we always recommend low sodium diet. These are examples of the sodium. The high sodium food, processed food, canned food, frozen dinner. Also the low sodium, we go fresh food, any kind of fresh food, frozen vegetables. You can also check the nutrition label, and also you can see low sodium canned. I'm sorry, I have to use one of these with a low sodium label, and I'm not recommending this product, but this is example, and the goal is 2,000 to 2,300 milligrams per day. So 2,300 milligrams is recommended by the kidney foundations and also the international kidney recommendation. I put the 2,000 because we used to have 2,000 as the goal, and then patients who had cardiac condition, usually cardiologists recommend 2,000 milligram. So if you consume between 2,000 and 2,300 milligram of sodium, that is good. The second thing that we have to watch in our diet, except protein, the potassium. Why potassium is important? It's a very important electrolyte. It's important for muscle contraction in the body. And the most important muscle in the body is the heart. With chronic kidney disease, kidney is not able to excrete the extra potassium in the blood. So this potassium can be elevated with advanced kidney disease. And you need to know what the normal range of potassium is. The safe zone is between 3.5 to 5. And it can be vary slightly in different institutes. So it can be 3.3 to 5.1. It can be 3.6 to 5.2. It depends on the institute. As long as you maintain your potassium within this range, it's safe. The caution zone is 5.1 to 5.9. So those are more like very common standard in the United States. And if a patient has above 5.5, usually dietitians involved about the decrease low potassium diet. But there is a danger zone greater than 6. Usually patient is sent to emergency room to check the electrocardiogram, make sure that the heart is okay. So it became heart rhythm gets irregular with the high potassium. It also happened with the very low potassium. So that's why maintaining 3.5 to 5 range of potassium is very important. Know your potassium level in the blood. That's important. So what can cause elevation of potassium? First, medication. There are few blood pressure medications. It's called angiotensin converting enzyme inhibitor. We call ACE inhibitors. And these are very common medications called lisinopril, captopril, enalapril, benazepril, ramipril. Everything ends with the PLIL. So those are ACE inhibitors. There are similar type, it's called angiotensin receptor blocker. It's an ARB. It's a norcertan, valsartan, olmesartan, irbesartan. So you see sartan at the end. Those are the ones also called ARB. And these two are it's the number one blood pressure medication for high blood pressure, with diabetes, also cardiology. They recommend this medication for cardiac health. And also the third group of medication is water pill. So it's diuretics, and it's called potassium sparing water pill. So there are two used most often. It's a spironolactone and amiloride. So this most of the time when patients take water pill, like for an example, furosemide, hydrochlorothiazide, those torsemide, they usually eliminate potassium in the blood. And if combination of this ACE or ARBs, they usually maintain normal. But sometimes the patient take a different kind, and then it can cause elevation of the potassium. Why do you need this medication? Blood pressure control, cardiovascular disease, but it has very important side effect, elevation of potassium. So diet. Patient take this medication, and patient eat a moderate high potassium diet with this medication can elevation of potassium, or patient eat so much high potassium food. Okay. So these are high potassium food. Potatoes, white and sweet potatoes. Both of them are very high in potassium. Tomato product. Tomato sauce. I often have patients who are Italian just saying, I make a fresh tomato sauce, not adding any salt. Okay, they are good for the low sodium. However, they are very high in potassium. banana, prune, stewed prune juice, coconut milk, one of very popular items nowadays, beans. Vegetarians often eat a lot of beans. Raisin bran cereal. This is the only cereal has very high potassium because it also has dry fruit, light salt substitute, orange juice. All of these are very high potassium. And the low potassium food, rice, noodles, berries, strawberries, blueberries, any type of berries, cauliflower, onions, mushrooms, cucumber. There are a bunch of other lists, not only these ones on the this slide that I just put them in. But you have to remember all protein food are high in potassium. So if you have red meat, if you have fish, salmon, all of these are high in potassium. However, and also we just allow these food, the protein sources, because protein is important body function, but there are a lot of different fruit and vegetables. That's why we recommend the low potassium fruit and vegetables for our patient. Also, portion is very important. I mentioned about berries are good, but if they usually all of these fruit portion, 1 cup is the portion size. However, sometimes patient consume is the strawberry season, 1 pound of the strawberry at once. So it's about 3-4 cups of the serving. So that will increase the potassium as well. So it's always important to know about the portion size. And also all this potassium recommendation should be individualized because it also varies depending on body size, how much protein this patient needs, and then how much potassium they need from the fruit and vegetables. So there is no one number is good for this recommendation. So how to keep your potassium level in the safe zone? Know your potassium level, know your medication. Also, if you have high potassium level, limit the high potassium food. Usually for fruit and vegetables, eat a variety of food in moderation. So if someone like potato all the time, what you do is also, we recommend a certain way to cut down potassium from the potato. Okay, it only works for the white potato. So it's a small portion, just peel off the skin, boil once, change the water, boil one more time, and then throw away the water. That will lower the potassium for 50%. In the past, peel off the skin, soak it in the water. It doesn't decrease the potassium as much as boiling twice. So that is the only thing about the modifying method to lower the potassium content of the food. Do not drink or use liquid from canned fruit or vegetables, because sometimes they put it as some fruit or some vegetables in juice, not adding any sugar or salt. So they kind of use some of them in cooking, and those are pretty much high in potassium. Also remember portion size, very important. If you have a low potassium level, you can consume any of this high potassium food, because as I mentioned earlier, potassium level should be maintained between 3.5 to 5 range. If someone has 2.9 or 3 potassium, it's another warning sign. For too low potassium, often patient takes potassium chloride as supplemented to maintain it. It has a similar effect as high potassium. All recommendations should be individualized to keep the potassium level in normal range. There are some potassium lowering medication, but I'm not going to address that this time. Phosphorus. Sometimes we talk about phosphorus a lot. And what does phosphorus do? Phosphorus is a mineral that helps the bones healthy, keep the blood vessels and muscles working properly. Why phosphorus is important with the patient with the CKD. With the progression of the CKD, phosphorus can be built up in the muscle, and the muscles became accumulation of calcium phosphorus. So, and also phosphorus is not effectively eliminated by the kidney. And also it can make bone being thin, weak, and break. You just to say why it's important for the bone healthy, but why the phosphorus can be lower. There are very complicated mechanism of the blood calcium, phosphorus, and something called parathyroid hormone. Those are all controlled by kidney. So that is why that the bones getting thin and weak, and we call kidney-related bone disease. Should the phosphorus be restricted in all CKD and polycystic kidney disease? The answer is no. Phosphorus can be elevated with advanced stage of the kidney disease. If you maintain normal phosphorus just the normal phosphorus level in the blood, the restriction is not necessary in early stage of kidney problem. How do you find phosphorus in the food? Phosphorus is not on the label by the law, but you can still check nutrition fact label. So many packaged food contain additives containing phosphorus. Make sure these additives, you find it, avoid this food. So ingredient is in the label, so you can see that anything with the phos, those are the ones with additives. How to maintain good phosphorus consumption? Do not consume excess protein in the food. Phosphorus is bound with protein. So meat, poultry, fish, those are the animal protein, and also the plant-based protein has also phosphorus in there, but the absorption rate is a little bit different. Dairy product, the 1 cup of milk, 1 ounce of cheese, just is usually allowed if a patient have a high phosphorus level. If a patient doesn't have a high phosphorus and like to have some milk, we are okay with that. We usually recommend the low fat, but the cheese, we always recommend the patient to read it because of the sodium content. If someone has a high phosphorus, you can choose non-dairy milk, which are low in phosphorus, like almond milk, oat milk, rice milk. Plant-based protein is better phosphorus absorption, even though the number is higher, but still the absorption is different. And limit and avoid the processed food as much as you can. Eat more fresh fruit and vegetables. They are low in phosphorus. So high phosphorus food, all food are rich in protein, especially dairy product, organ meat, beans, brand products, nuts and seed, processed food. So those are high phosphorus food. And the low phosphorus food is the fresh fruit, non-dairy, just milk. And also this phosphorus should be individualized as well. Now we are going to talk about the various diet, because there are so many different types of diet nowadays available. So these are mostly discussed diet that we see. The dietary approach to stop hypertension. Everyone heard about DASH diet. Mediterranean diet, another very popular, well-balanced diet. Vegetarian diet is this better than regular diet? Or intermittent fasting, is this better? Keto diet, is it safe for CKD or PKD patient? DASH diet is recommended for hypertension and heart disease. The DASH diet is low sodium, high consumption of fruit and vegetables, also recommend the low-fat dairy product, less red meat, more fish and chicken. Mediterranean diet is recommended for cardiovascular disease and also say delay progression of the chronic kidney disease. It has a lot of plant food it has a minimal red and processed meat, moderate amount of dairy, olive oil as main fat source, and moderate amount of the wine with meals. So this is comparison of DASH and Mediterranean diet. So on the fruit and vegetable part, they are similar. The Mediterranean diet is usually consumed by the Southern European countries, and they are consuming a lot of olive oil. So they mention about the veggie oil, which is olive oil, and it also have dairy, some sorts of cheese. And DASH diet has low-fat dairy, seafood, poultry, and lean meat. For Mediterranean diet, the less protein food, poultry, and seafood. And for DASH diet, has beans, nuts, and seed on the separate, and fat and oil here. And sweet and meat and sweet are really very small consumption in Mediterranean diet as well. So the DASH diet is aimed for reducing hypertension and also reduce the intake of the saturated fat, trans, and also sodium. Mediterranean diet is consumption of whole food, including fruit and vegetables, but they're very, very similar. Well-balanced, healthy eating. I just get this information from Harvard School of Public Health. This is not for specific, but CKD or PKD. It's a general recommendation for all Americans to prevent chronic kidney disease. So this is like a healthy eating for more general population, and early stage of kidney disease or PKD, you can still have the healthy eating habit. Now, vegetarian diet. The recent studies say no specific benefit for CKD or PKD. I know many dietitians and a lot of healthcare professionals recommend the vegetarian diet over regular diet. There are some benefits for a certain group of people, but not in general in the study. So there are two different vegetarian, lacto-ovo vegetarian, all the vegetables but include dairy, product, and eggs. Vegan diet is no animal product. So it's all grains and all vegetables, and the proteins are coming from seeds and nuts and beans. So these are the protein sources. So a vegan diet does not have any animal produce in the diet. Intermittent fasting. There is no proven health benefit for CKD or PKD because they are eating for 8 hours and 16 hours of fasting. It's not recommended for patients with diabetes because of the blood sugar control. But with the cultural aspect, this diet plan can be modified on the patient's individual need. So I'm not saying the intermittent fasting is bad for everybody. If the patient with CKD or PKD without diabetes, it can be modified. The last diet, ketogenic diet. It's very popular, but I like to let you know about the classic ketogenic diet. It's a therapeutic for epilepsy. So it's really low carbohydrate, very low protein, and very high fat. So 4 to 5% of calories are coming from carbohydrate, 6% from protein, 90% fat. So that's a therapeutic diet. Plant-based keto diet, they have about 10 to 15 carbohydrate, 10 to 15% of protein, and still high fat, 70 to 75%. Modified keto diet, that is the most common for people eating. It's an Atkins diet. 10 to 20 grams of the carbohydrate, high fat, and also unlimited protein. And I told you earlier, high protein is really bad for the kidney. And this is also bad for the cardiovascular disease as well. So on the, like you could see, there are very little carbohydrate, probably just a little from the fruit, but all of fat and protein. Low glycemic index treatment. It also permits low glycemic index food, the less than 50. So higher the glycemic index is higher, increase the blood sugar. So allow moderate carbohydrate intake of about 40 to 60 grams per day and encourage lower rise in blood glucose. And that's why it has more protein, more fat. We don't talk about low glycemic index like treatment often for our patient population. Now I'm going to talk to the adverse effect of the keto diet. It's all type. It's all about the either plant-based or it's also regular keto diet. It can cause metabolic acidosis. We talk about a little bit about the acid-base balance in the blood. So blood can be more acidic. It's because of the kidney function is not working. So blood should be more neutral because the patient follows this keto diet, the body can be more acidic because of excess production of the ketones. It can cause dyslipidemia, so it can increase cholesterol, bad cholesterol, and increase cardiovascular disease. And also patients have a lot of GI issues. Cutting down all the carbohydrate and eating a lot of fat is also called keto flu and also called ketosis. And it can cause nausea, vomit, diarrhea, constipation. All these GI issues, gastrointestinal issues can also lead to dehydration. Also, it can cause low blood sugar, also low blood pressure. And also unintentional weight loss. I know most people try to follow keto diet to lose weight, but not everybody want to lose weight. But anyone who started this diet can be like very common to lose weight right away. Now, there is something called new plant-based keto diet for polycystic kidney disease. There are some group, they recommend a lot of this plant-based keto diet because it's only effective in animal studies because animals can be fasting, time-restricted feeding, but we are not animals. There are a few ongoing human studies for weight loss with this keto diet, but a lot of these patients also drop out because of the adverse effect at the beginning, and it's very difficult to follow this diet. So we didn't have any good conclusion from this diet. And this also recommend the beta hydroxybutyrate. This is a ketone. Is you can easily find it in like Amazon or any website. And there is no evidence of helping the cyst growth for the polycystic kidney problem patient, and they are expensive. And also this group recommend a lot of different blood work. And the other thing is polycystic kidney problem patient usually have a higher risk of the kidney stone, but with this following this diet, it can even increase more kidney stones. So we do not recommend this diet for PKD patient until human study proves this hypothesis about this diet can lower cyst growth. So that is the important thing. It's a very popular. You see so many advertisement and everything. So please be careful. If you want to follow any of this diet, please talk to your nephrologist or someone, some dietitian who knows about this information. Now I'm going to show you two different healthy eating meal patterns. So I just made a 70-gram protein because it's like most people are like about 180, 170 pounds with men. So I just put it as 70-gram protein as regular diet. So it's just total amount of the meat per day is about 6 ounces. And we do not restrict any fruit or vegetables unless there is a problem with their blood work. we have some moderate amount of starch. And this is sample meal plan. I made for breakfast, some snack, lunch, afternoon snack, and dinner. And I also analyzed this diet by the computer program. So it gives about like 1,500 calories, 70-gram proteins, a low sodium, moderate amount of potassium and phosphorus. So it can fit for many of your meal pattern for if someone needs to follow any specific diet for CKD. Also, I created a meal plan for vegetarian. So they're very similar. I did not put the amount because everything should be varied depending on the nutrient information. So again, a breakfast, instead of regular milk, I put the almond milk, and the snacks can be some nuts and also some beans, lentils. It's going to be in the in your meal pattern, and also the tofu or any other some protein sources included. And if you see that, it's a higher calorie. The vegetarian food always do not cause weight loss all the time, because it can also people can use more fat in the diet, especially olive oil or the plant-based fat. So it can still do being healthy, but also produce adequate calories. It can be all modified. It's easily modified by some of the ingredients. So in summary, the general healthy eating is the most appropriate for all CKD, PKD patients. Moderate to low protein diet. Its appropriate amount of the protein is very important because it's based on the weight. Everyone needs to follow low sodium. So modify the keto diet for weight management. It aggravates the progression of the CKD. So we do not recommend the keto diet, especially Atkins diet. And plant-based keto diet for PKD is promoted by some group, but there is no evidence in humans to prevent the cyst growth at this point. So we do not recommend it. DASH or Mediterranean diet are acceptable for cardiovascular health and blood pressure control. And but it doesn't really show like a very positive effect on the prevention of the progression of kidney disease yet. But it's still healthy diet, and they are not high in protein. So all diet recommendation for CKD, PKD should be individualized based on patient current medical condition. Thank you.